I am in the program, the National Clinician Scholars Program at the University of Michigan. It's a 2-year health services research fellowship. I'm working with a couple different people. One is Dr. John Scott, and with him I'm mainly looking at the financial toxicity and the affordability and accessibility of surgery. Another mentor I'm working with is Dr. Hari Nathan, and with him we're focusing on looking at the impact of social risk on surgical outcomes and access to timely surgery, mainly through looking at patients that are eligible for both Medicaid and Medicare. They're called dual eligible patients. And then I also did some projects with an OBGYN, Dr. Michelle Moniz, on the affordability of maternal care and patients that are pregnant. I came into residency knowing that I wanted to do the National Clinician Scholars Program. I had heard about it when I was a medical student, and I thought that it would be a really great opportunity to get training in health services research. I, before residency in medical school, spent a year in Rwanda doing a global surgery fellowship. And during that time, really loved the experience, but I felt like I didn't have the research skills that I needed. And a lot of the residents that I worked with, the Rwandan residents in anesthesia or emergency medicine or general surgery, were asking for more training and research. And so I felt that in my future career, hopefully will involve global surgery, I wanted to be able to lend those health services research skills to those environments. I think there's a program like it at Stanford too, but part of the National Clinician Scholars Program is this leadership course. And through that, we spend a lot of time figuring out what's your why and where we want to make our impact, and sort of focusing in on, instead of having like external factors shaping what we're interested in, kind of really getting to what we're interested in and want to move forward in our career, either studying or working in policy. So I think that course has really been helpful. I sort of see myself taking the skills that I've learned in this fellowship and being able to apply it to global surgery in the future, especially because I know a lot more countries are starting to implement national surgical plans to address the need for surgery in a lot of low and middle income countries. And I was a part of that effort in Rwanda. So I see that in the future there's going to be monitoring and evaluation that's needed, and I think health services research can play a part in that.